Welcome to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness throughout your journey in life. Your host is Dr. Emran, a respected physician who's treated thousands of people just like you over the past 10 years. Listen to the show each week on iTunes, iHeartRadio, Spreaker, and 3 and Out Radio Network. Information provided on this show is not a substitute for professional medical advice. Always discuss your questions with your doctor or go to your nearest emergency room immediately.
Thank you so much for joining me today on Simple Health Radio. I'm your host, Dr. Emran. On today's episode, we have a very special guest. Her name is Shelly Rael, and she is a registered dietitian. She has many years of experience in the areas of wellness and disease prevention, and I thought it would be a wonderful topic and a wonderful idea for her to be a guest on our show. Are you there, Shelly?
I am. Good afternoon, Dr. Emran.
Yes, thank you so much for calling in. Yes, ma'am. No problem. So you're calling us, is it from New Mexico?
I am located in Albuquerque, New Mexico, but I do work virtually with a lot of people.
Excellent. Well, tell us a little bit about your background and the training so that our listeners get a better sense of what a registered dietitian actually is.
Right. Okay. So I'm a registered dietitian or an RD, and some of us do use the credential RDN or registered dietitian nutritionist. So they are the same thing. And I've been a dietitian since 1999. And as you said, I worked in the area of wellness, but a lot of people get confused about what a registered dietitian does and how we get our credentials. So a lot of people can call themselves a nutritionist or a nutrition coach. And that doesn't necessarily mean anything with regard to any type of credential or education. Some people may just do a weekend course online and they can call themselves a nutritionist. Where on the other hand, a registered dietitian, we do have degree requirements. So I have both my bachelor and my master's degree in nutrition. And it's a science. So a lot of people aren't aware of that. So it's one of the STEM fields. So I do have education in biochemistry and physiology, chemistry, as well as nutrition. But as well as with the education, we actually have a required internship. So we have 900 hours of unpaid training that is a competitive internship. So nationwide right now, we only have about a 50% placement of that. And we can't even sit for our registration exam until we have completed that internship. And then we have ongoing continuing education requirements that we have to have. We have a governing or a credentialing agency. So there is a lot that we have to go through to become a registered dietitian. And like I said, it's a science field, and a lot of people are unaware that it's related to the medical science field at all.
Wow. No, I wasn't aware of all the differences and the nuances that you just described. So it sounds like you and I have done medical school together, because everything you described, those are all the classes that we were also required to take. So I'm glad that you emphasized that. Now, after you complete the internship, after you've completed all the hours, you sit for a national board, or is it a state board exam?
It's a national board that we sit for. So all of us who take the exam are sitting for the same exam, and it's a national credential. I can't recall, but we're very similar with Canada, but I think it is a different exam, but we do have a lot of overlap. And I do have to emphasize this. Not all states have a licensure requirement. Many states do. So whether somebody is licensed in their state just depends on the state. In New Mexico, we do have a licensure that is in addition to the national credentialing exam.
Excellent. Very good. Well, thank you for clarifying that point as well. Now, tell us a little bit about your day-to-day work. So you work with clinicians, you work with hospitals, you work with patients. Where is most of your time focused at this time, throughout your career?
Well, for me, I do have my own private practice, so I work with people one-on-one. I also do professional speaking about nutrition. So I help people who want to have more physical energy. So I help them fuel their body so they have sustainable energy. And that's mostly what I do right now as part of my private practice. And then, as I said, I worked in the area of wellness and disease prevention. Actually, that's what I still do. But in a corporate setting, I was in a worksite wellness program. So helping people reduce their risk of disease. Now, that happens to be what I do. It just happens to be, this is my preference. I prefer to help people before they're sick. But as dietitians, we're a very diverse group of individuals. I say similar to physicians. Some have their specialty in neurology or orthopedics or emergency. but you're all physicians, so we're all dietitians, but we have our different specialty areas. So some dietitians work in a hospital setting, or they work with diabetes or kidney disease, or some work with sports nutrition. Others, some are in hospitals, some are in school systems. So diversity, and really I tell people there's just so many things that we do. We just tend to have our own specialty areas. I work with adults for the most part, and like I said, with wellness, but I know some dietitians who only work with children in the pediatric area. So quite a diverse group of us.
Wow, excellent. No, I wasn't aware that there's so many nuances to even that in terms of the age range and the specialties. I have seen in the past, even though I'm an ER doctor, I do refer many patients to see a dietitian when they have diabetes that's out of control. Maybe they've had 2 or 3 hospitalizations because they're taking their medication, but maybe the foods they're eating are not the ones that they're supposed to be eating. And so it's kind of eye-opening for them to really sit down with someone like yourself to explain the carbohydrates, to explain the protein, and some of the other nutrients that they require. So I'm very pleased that you mentioned that not all dietitians are the same. I think there's a focus that we need to be sure we're sending our patients to the right department for the right care at the right time, certainly. Very good.
I just find it unfortunate, and I do know a lot of people from this aspect do end up in the emergency department with unmanageable or uncontrolled diabetes, and I do know some people who have had the diagnosis of diabetes but have never been referred to a dietitian to help them manage the disease, and then they end up in the emergency department, and that's not a good place to be, in my opinion.
Absolutely. No, I agree with you 100% on that. Now, tell us a little bit, your new website, you have a very large following on social media. You're on Facebook, Instagram, Twitter, LinkedIn, and you have your own website as well, which is shellyrael.com. You talk about the word diet. So what is the real meaning of the word diet?
So that's a question I even asked on social media today. So what does diet mean to people? The real meaning of the word diet is a pattern of eating. That's all it is our pattern of eating. So when I ask somebody, so tell me about your typical diet, and I've had people say, well, I'm not on a diet. Well, really, people are, because how they eat on a day-to-day basis is referred a diet, a person's overall diet. Our society is four-letter, it has become negative in it. Most people automatically go to the term weight loss, which that can be part of it, of course. But for example, there's a diet called the DASH diet that can help with high blood pressure and actually reducing the chance of somebody having a high blood pressure. But it's not really a diet that's full of restrictions. It's just referring to a pattern of eating. So I am really in the process of recognizing that not everybody sees or hears that word diet the same way I understand it. A lot of people tend to think of it from a negative point of view. And really, it's nothing more than how somebody eats.
I see. Excellent. And that is a good clarification because, as you said, there's a stigma associated with what we eat, how we eat it, when we eat it, as well as obesity and even the opposite, which would be anorexia and bulimia. So I think dietitians play a very critical role in that. So I'm glad that you have been getting feedback and engaging with people on social media about what a diet truly is. Now, tell us a little bit about the future. So where are your thoughts? Where are your paths going to take you in the next 5 years or 10 years? How do you see yourself engaging differently than what you have done in the past?
Well, really, I'm still trying to understand how people are listening or hearing what I have to say. So one of the things, as I said already, is I help people have more energy through food. So when people are feeling tired in the morning, they don't want to get up, or have that time in the afternoon where they're feeling really tired and they want to take a nap. In a lot of cases, that is related to how they eat. But a lot of people don't get that relationship. They don't understand that their food has a relationship with how they feel, their disease risk, so whether they may get diabetes or heart disease or certain types of cancer. So I want to get the message out to let people know that their pattern of eating today affects how they feel today, tomorrow, and their risk for disease down the road. And so many people think, well, my genetics. And I have a lot of genes that are going to put me at risk for certain chronic disease. But I tell people what I do is I have my diet or my pattern of eating really helping me reduce that risk of if or when that disease may present itself. So I want to have this ongoing dialogue and get the message out that we don't want to change how we eat after we have a diagnosis, but before that diagnosis comes. And of course, not all of that will always happen, but I've known people who have said, I'm going to wait till I hear for sure if I have this disease before I change my diet. And I'm like, why not do it today? And you'll feel so much better. So that's just my ongoing message to tell people, to share with people, to get the information that how we eat today does affect us tomorrow.
Absolutely. No, that's a very unique spin on that. So I think your focus on prevention is very, very well suited for our modern day society. And a lot of the diseases that we are seeing, high blood pressure, diabetes, cancer, all of these things, I believe, have a relationship with what we are actually putting into our bodies, whether it's nutrition, whether it's chemicals, whether it's supplements. So I do agree with you completely on the way that you've described it, that we need to prevent these from happening in the first place. Otherwise, to cure them afterwards, I think would be very, very difficult, even with motivation, exercise, all those things. And I'm glad that you focused on that for sure.
Right. And prevention is, like you said, prevention. It's easier to prevent something than it is to treat the disease.
Absolutely.
After the diagnosis. Yeah.
Absolutely.
Yeah.
Very good. Excellent. Well, we have just a few more minutes, so can you leave us with some final thoughts and perhaps something that we can take day to day, something to heart that you think a lot of our audience would really respond well to?
Sure. I have two things that I'd love to say is one meal, one food is not going to make or break somebody. It's not going to give you disease today. It's a pattern of eating. So I just tell people, don't beat yourself about eating something and your healthier decision at your next meal. And that segues into my next message here is that people feel that they have to wait till Monday to start some first of the year. Making a healthier choice happens at any moment, and that can be with your next meal or your next eating episode. You do not have to wait and do not feel you have to have your last supper, so to speak, before you decide to make any changes. And that's just a decision you can make right now.
Phenomenal. Well, I think those are very wise words and words that we should all live by. So thank you again, Shelly Rael, for being a guest on our show today. I can tell that there's a book in your future, just the way that you've described everything so clearly. I think you're going to have a lot of followers on social media as well. And what we're going to do is transcribe this episode. We're going to make a blog, and I will link all of your social media, your Facebook, Instagram, Twitter, LinkedIn, as well as your website, which is shellyrael.com. And I'm sure that we're going to have you again on the future very soon.
Thank you so much. I was so glad to share today.
Excellent. So again, you've been listening to Simple Health Radio with Dr. Emran. You can follow us on Twitter, Instagram, Facebook, iTunes, Spotify, and many other platforms. And I do look forward to having all of you back on a future episode.